Hydromorphone is a potent opioid analgesic with pharmacological properties that make it effective. For pain management, here are some key aspects of its pharmacology. 1. Mechanism of action. Hydromorphone acts primarily as a opioid receptor agonist. It binds to and activates these receptors in the central nervous system, resulting in analgesia, pain relief, sedation, and other opioid-related effects. 2. Pharmacokinetics. Absorption. Hydromorphone can be administered orally, intravenously, intramuscularly, or via other routes. Intravenous administration provides rapid onset of action. Distribution. It distributes throughout the body, including the central nervous system. Metabolism. Hydromorphone is metabolized in the liver, primarily by glucuronidation, to its inactive metabolite, hydromorphone 3-glucuronide. Elimination. The metabolites are excreted mainly in the urine. 3. Half-life. The half-life of hydromorphone can vary but is typically around 2 to 3 hours. This means that the drug's effects wear off relatively quickly. For adults with moderate to severe pain, immediate-release tablets or oral solution. The initial dose is often 2 milligrams to 4 milligrams every 4 to 6 hours as needed. Your doctor may adjust this based on your response to the medication. Extended-release or formulations. A hydromorphone is designed to provide longer-lasting pain relief and is typically dosed once every 24 hours. Initial doses may range from 8 milligrams to 32 milligrams, depending on the patient's prior opioid exposure and individual factors. Hydromorphone, like other opioid medications, can have various side effects, and the severity and prevalence of these side effects can vary from person to person. Some of the most common side effects of hydromorphone include 1. Sedation. Hydromorphone can cause drowsiness and sedation. It is essential not to operate heavy machinery or engage in activities requiring alertness while taking this medication. 2. Constipation. Opioids, including hydromorphone, commonly cause constipation. Increasing fluid intake, dietary fiber, and the use of laxatives may help manage this side effect. 3. Nausea and vomiting. Some people may experience nausea and vomiting when taking hydromorphone. These side effects can often be managed with antiemetic medications. 4. Itching. Pruritus itching is another possible side effect, although it is less common than the ones mentioned above. 5. Dizziness. Hydromorphone can lead to dizziness, which can increase the risk of falls or accidents. Caution should be exercised, especially when getting up from a sitting or lying position. 6. Respiratory depression. Like all opioids, hydromorphone can depress the respiratory system. This is more likely at higher doses or with misuse. It's crucial to use this medication as prescribed to minimize this risk. 7. Sweating. Some people may experience sweating or diaphoresis while taking hydromorphone. 8. Confusion. Opioids can sometimes lead to confusion or cognitive impairment, particularly in older individuals. 9. Hypotension. Hydromorphone may cause low blood pressure, especially when moving from a seated or lying position to a standing one. 10. Urinary retention. Difficulty in urination or urinary retention can occur with hydromorphone use. 11. Dependence and withdrawal. Prolonged use of hydromorphone can lead to physical dependence, and abrupt discontinuation can result in withdrawal symptoms, including anxiety, restlessness, and flu-like symptoms. 12. Allergic reactions. While rare, allergic reactions to hydromorphone can occur, leading to symptoms like rash, itching, swelling, severe dizziness, or difficulty breathing. Seek immediate medical attention if any signs of an allergic reaction occur. Hydromorphone, like other medications, can interact with various drugs, potentially affecting their efficacy or increasing the risk of side effects. Some common interactions of hydromorphone include 1. Other central nervous system CNS depressants. Combining hydromorphone with other CNS depressants, such as benzodiazepines, sedative hypnotics, alcohol, or certain muscle relaxants, can lead to increased sedation, respiratory depression, and the risk of overdose. These interactions can be life-threatening. 2 monoamine oxidase inhibitors MAOs, used to treat depression and certain other mental health conditions, can interact with opioids like hydromorphone, potentially causing serotonin syndrome, a serious condition characterized by agitation, high body temperature, increased reflexes, tremor, sweating, dilated pupils, and more. This interaction is rare but severe. 3. SNRs and SSRIs. Some antidepressant medications, such as SNRs and SSRIs, can increase the risk of serotonin syndrome when combined with hydromorphone. This risk is relatively low but should be monitored. 4. Anticholinergic medications. Combining hydromorphone with drugs that have anticholinergic properties, e.g., some antihistamines, antipsychotics, and tricyclic antidepressants can increase the risk of constipation and other anticholinergic side effects. 5. Medications that affect hepatic metabolism. Drugs that inhibit or induce hepatic enzymes may alter the metabolism of hydromorphone. For example, inhibitors of CYP3A for e.g. ketoconazole can increase hydromorphone levels, while inducers e.g. rifampin can decrease its effectiveness. 6. Medications affecting gastrointestinal motility. Medications that slow down gastrointestinal motility, e.g., certain antidiarrheals and antispasmodics, can exacerbate constipation when taken with hydromorphone. 7. Opioid antagonists. Drugs like naloxone, which are used to reverse the effects of opioids, can precipitate opioid withdrawal symptoms if administered to someone who is physically dependent on hydromorphone. 8. Cimetidine. Cimetidine, used to treat gastrointestinal issues, can increase the plasma concentration of hydromorphone, potentially leading to enhanced opioid effects. 9. Phenytoin. Hydromorphone may reduce the effectiveness of phenytoin, an anticonvulsant, by increasing its metabolism. 10. HIV protease inhibitors. Some HIV protease inhibitors may interact with hydromorphone, potentially affecting its metabolism and blood levels.